Hello, I'm here to teach again, so here we go. Today is heart failure. So heart failure, the heart is not pumping correctly. It's not functioning right, so it's not pushing the blood out far enough. And this leads to inadequate peripheral tissue perfusion because the blood flow to the body is compromised. There are two types or two classifications. There's chronic and acute. Chronic develops over time and can develop from acute, and acute comes on suddenly. So the adverse or the complication of heart failure is pulmonary edema. So things that we do for this is we place them in high Fowlers, we give them O2, we assess the client, and that includes their lungs. We listen, do a quick assessment. We give the diuretic that's ordered. We give the morphine to help them relax and breathe easy. It's totally against our nature to think morphine's going to help with that, but that's what we do. It helps them relax and they're not panicked, and so they get more air in. We put the Foley catheter in because they are having such a hard time breathing. They can't use the energy or the amount of oxygen it would take to get up or to use the bedpan. And if needed, we prepare to assist with an intubation. There are two types. There is right and left. Depending on which side is affected, depends on what kind of symptoms I'm going to see. So for right-sided, I'm going to see everything related to the body. All the symptoms are going to be body related. So dependent edema, and that can be in the feet, or if they're laying in bed all the time, their sacral, their back. Abdominal distension, splenomegaly, weight gain, swelling of the fingers and the hands, nocturnal diuresis, hepatomegaly, and anorexia. Now, we need to talk about if they have increased BP, that would be the fluid volume excess, and for decreased BP, that's the pump failure, okay? So if they have increased fluid, they have fluid volume excess, their blood pressure is going to go up. If it's decreased, if the blood pressure has gone down, the pump is failing. Okay, so left failure, left-sided, are all related to the lungs. And I tell my students here in the office and online when they're with me to remember LL, left lung, okay? So if, again, the pump isn't working and the fluid is going to build up and I'm pumping into the lungs, then the fluid, because the heart isn't pumping hard enough, is not going to push the blood out of the lungs to come back to the heart to be pumped to the body. So it builds up there. And we know if blood or fluid is pooling, it starts seeping into the tissue, and lungs are tissue. So it would start filling up. So pulmonary congestion, tachypnea, dyspnea, going to have a dry, hacky cough, but I'm going to hear crackles when I listen. They're going to have paradoxal nocturnal dyspnea, where they've been able to fall asleep, but then suddenly wake up short of breath. It's not because they've been exercising, they just suddenly wake up. That fluid from all the rest of the body has now come back to the trunk, and now they can't breathe because it's all in the one place. Again, increased BP is because of fluid volume excess. Decreased BP is because the pump is failing. So treatment. We need to teach the client about the meds, the DIG, and I've had a video about digoxin. And what it does for heart failure, it helps increase that pump, so it pushes the blood further out into the system and pushes blood back. The diuretic to pull off that extra fluid. The ACE inhibitors for the blood pressure, same with the beta blocker. And then the vasodilators help give the blood a better chance. It's not got as much pressure going out if the veins and the arteries are dilated. I need to teach them about a fluid restriction. I need to make sure to do daily weights and notify the MD if there's an increase. Remember that daily weights, if they go up or if they go down, they're losing fluid. If it's over 24 hours, they're losing fluid or they're gaining fluid. And so 1,000 milliliters of fluid is 2 kilograms or 2 kilograms. So if they go up, that is fluid, 1,000 milliliters, and it's in the body somewhere. Notify the MD if side effects occur from any of those meds. Encourage consumption of potassium-rich foods, because we're usually giving them a diuretic that is potassium wasting, like permosifide or Lasix. They need to avoid caffeine, and they need to alternate activity and rest, so they're not pushing their body for more oxygen. It's hard enough to get oxygen for what they need. They can't do a whole lot and then expect their body to keep up. It's just not going to happen. Okay, this was short, sweet, and to the point. I hope it helps. Remember, this video is all about one-on-one NCLEX tutoring, and you can find us at oneononeclextutoring.com. Okay, hope you have a good day. It's good to see you. Bye-bye.